The learning objectives are the clinical reasoning for using tape as an intervention, when to use ankle taping clinically, the basic steps of properly taping an ankle, how to functionally test an ankle tape, the appropriate way to take off an ankle tape, and feel confident in performing the steps required to complete ankle taping. The reasons for the use of tape are for structural support, to provide proprioceptive feedback, and it can be used either prophylactically or for post-injury management. Our required materials are pre-wrap, heel and lace pads, adhesive tough skin, 1.5-inch athletic tape, and the Shark tool.
Prepare the area to be taped by exposing only the lower leg, ankle, and foot so only bare skin is exposed. Then next, ask the patient if they are allergic to adhesive spray. If they are not allergic to the spray, apply the spray now. You will then apply heel and lace pads to the patient to decrease friction and prevent any blisters from occurring. Apply the first heel and lace pad to the anterior portion of the talocrural space and the posterior portion. You'll then apply pre-wrap. Pre-wrap moves in a circular motion around the leg, starting at the gastrocnemius musculotendinous joint, ending around the base of the fifth metatarsal. It is important to note not to have any wrinkles in this. Next, apply anchor strips. Apply 2 anchor strips at the base of the gastrocnemius, overlapping one another by 1/4 to 1/2 inch. Apply an anchor strip near the base of the fifth metatarsal. It is important to make sure that this is not too tight. If it is too tight, it will disrupt blood flow and disrupt the foot arch. Next, apply C-strips and stirrups. You will put the C-strip around the medial malleolus, pulling laterally around the foot. You will then apply a stirrup, pulling from medial to lateral around the plantar surface of the foot. You will then repeat this 2 times, so there are 3 C-strips and 3 stirrups. This will prevent the ankle from moving into inversion and lock the ankle into eversion. The next step is to apply heel locks. You will apply 4 heel locks, starting at the base of the talocrural joint, going around the posterior aspect of the calcaneus, stopping at the base of the talocrural joint again. You will apply 4 of these, but each clinician tapes differently. This will also lock the heel in place. You will then apply 2 figure 8s, going around the base of the foot and then around the calcaneus again. This will also help lock the foot into place. Again, each clinician tapes differently. It is important to not force the tape. You will then end the tape job by closing it out, covering all pre-wrap exposed. You will work your way up the ankle, all the way up to the base of the gastrocnemius. You will then look to see if there are any holes in the tape. Try to prevent any wrinkles from occurring.
And then you will check the capillary refill of the patient to ensure distal circulation. To test the functionality of the tape, try moving the taped ankle throughout a range of motion. It should have decreased inversion and other ankle range of motion compared to the untaped. Following this, have the athlete stand up and walk around to determine if this is comfortable for them. Lastly, for the patient to take it off, they will use the Shark tool. They will use the straight side of the Shark tool and they will loop it down the medial side of their leg behind their malleolus and ultimately cut it off at the bottom of their foot. And they will dispose of the tape properly in the garbage and will wash off their leg from any adhesive spray that is still on there.
An important safety consideration to take into account is to check capillary refill to determine circulation in the toes. You also want to make sure you're not pulling the ankle into inversion by mistake. The key is to tape the foot into slight eversion or neutral position. Also, make sure you have a comprehensive clinical evaluation before applying tape. The usage summary is that it can be used prophylactically to prevent injury or post-injury to provide support for an athlete. It is important to note, while each clinician may tape a little differently based on how they learned, all of the base elements such as heelocks and figure eights and stirrups are within this video.